Fantastic. So what I'm going to do just before we go to break, hopefully, is give a bit more of an explanation about THinK and the campaign and why we've asked you all here today, and hopefully the role you can play alongside us definitely over the next year. There's lots of stats and statistics on here, data. I'm not really going to be going through that because many people in the room will probably be aware of the facts and the data that surround their services or the professions they're in. What I wanted to do is just kind of bring it all together and just explain how we're using that moving forward. Obviously, as Matt alluded to, this year we're going to start with 6 specific campaigns around THinK. Now, just to be clear, in case anyone's forgotten or wondering, THinK stands for Teenage Health in Knowsley. And it's a brand that's been around for quite some time, and young people were involved in the original design of THinK and what it meant and things. So what we're trying to do is not recreate the wheel. What we want to do is have one brand that young people recognise that all your services can link into and feed under, because we've got so many services in the room, you know, different organisations, different providers, and young people tell us that it can be quite hard sometimes to know which service does which and which provider does what. So we'd like to bring it all under the banner of THinK, which is Teenage Health in Knowsley. And when we speak to young people, and we have spoke to young people, they've said, oh, THinK, that's just the, you know, the sexual health service, or it's just this, it's just that. Part of my job is to work with the young advisors over the next year to make young people realise that actually they can go to all these services under the banner of THinK and get support on, you know, all the issues that you saw kind of in the drama piece and so much more. You know, we know that we're making great headway with a lot of things. We know that things are improving around a lot of, you know, of these issues. Smoke and alcohol are on there, for example. But we know against some national and regional averages and statistical neighbours, we've still got a lot of work to do. I mean, even just some of the drama pieces, I think it was Steve there said all of those young people need support, and I think they all do. And, you know, there will always be young people who need our support. And what we want to try and do is use everyone in this room's experience and years of knowledge to make sure that when we're going out and sharing the message with young people, that obviously, you know, we've got that right. I mean, you know, there's some on there which, and I think it was really interesting that a lot of people pick cannabis. We know cannabis is a massive issue for the most important piece that we saw earlier. But interestingly for me, it was the gambling one that stuck out for me. And I think, you know, we know that that's an emerging theme, not just in Knowsley, but across the country with young people. And what we want to do over the length of this next 12 months is not just tackle the 6 that kind of I'm going to move on to in a second, giving you some more information about, but look at other themes that emerge. I'm going to use the word legal high, and it's only because I can't pronounce the official psycho act. Someone help me out here, Ian. That's the one. You know, we know that's an emerging theme as well. So while we're going to be doing a lot of work on 6 pre-agreed themes, we're also going to be, through our website, doing a lot more promotion around new and emerging themes. The campaign basically is going to take two forms. There's going to be an online campaign, and there's going to be what we call an offline campaign, which will include posters, promotional workshops, events, kind of what we're doing here now with you as professionals, taking that out on a smaller scale to young people. The 6 campaigns, the 6 themes we're really going to be focusing on this year are gambling, emergency hormone contraception, alcohol, cannabis, well-being and sexual health. So they're the ones that are going to have 6 bespoke poster campaigns, and we're going to be running workshops on with young people. We're going to be coming to yourselves and asking for advice. My colleague Ian, who's at the back, has probably already met with some of you around some of these themes to make sure that the content and the messages we're giving to young people are accurate, up to date and obviously factual. Now, the campaign is going to be an initial 12-month piece of work where we're going to go out and tell young people about those 6 issues. We're going to tell them about the THinK website, and after the break, we're going to be asking for your thoughts and contributions about how your services and the work you do can contribute to that website, so that there's no gap, so that, you know, it can kind of be a signpost and website where any information around young people's health and well-being can be included. And what we're also going to do, talking about doing it differently, part of the work we're going to be doing alongside public health is our young advisors, and Peter, who's our communications and IT officer at the back, will be offering all the services in the room and services who aren't here training so that they're able to go on and update the website themselves. It's a really simple and easy to update website, but we'll cover that a bit more after the break. Promote and THinK as a brand's massive. We've already touched on that. You know, there's a lot of services in the room who do wonderful work, because I've worked with some of the services in the room. But again, you know, feedback from young people, just saying it as it is that they don't know, or they're not sure, or they're not aware, or is it for us, is it for adults? So we want to kind of use that THinK branding to make sure that young people know anything they see that's got this THINK branding on is a service that they can access, is a service that's going to be welcoming, and ultimately is a service that's going to help them, you know, hopefully with a multitude of issues. You know, one of the reasons we've got all the different services in the room today is to start looking at that, how you all can network and make sure you're aware of the other services that are in Knowsley to support young people, because, you know, that's key. We've seen some of the issues there where young people might have one issue but it's leading into another issue, and I'm sure you all work with young people where you know that's the case, and we want to make sure that this is a well-rounded piece of work that allows young people to get the support they need for all their different issues. So how we're going to do it, because that's what people keep asking me, commissioners keep asking, how are we going to do it? A lot of the work with young people is going to be peer-to-peer. So we're going to be using our young advisors who are going to be facilitating some of the sessions with you later on today to kind of go out and spread those messages. That might be tailored workshops where they go and spend an hour with a group of young people and deliver some messaging about a specific issue. It might be as simple as going into a school during a lunchtime and holding a marketplace stand where they don't promote any specific issue, but they promote THINK and the website. I'm sure some of you will be aware of some of the issues we have with schools sometimes around promoting certain health aspects. So, you know, promoting THINK as a generic brand allows us to just go in and signpost to that website, signpost to services without going into too much detail. We're also going to be doing things like using our mobile youth facility at things like the Knowsley Flower Show to have, you know, a stand there where we can not just promote to young people, but we can promote to the whole family. You know, picking up on some of the issues in the drama piece earlier on around not being able to talk to mum or to dad or anyone, or them not being aware of what support's there, you know, making sure the families are aware. And, you know, we're hopefully going to be working with some of our colleagues in Family First, Stronger Families and other organisations to make sure that they're clear of this messaging so they can pass it on to the whole family and not just the young people. I say, just to show you a bit more what the campaigns are going to look like, there's some things on your table. You've got a delegate pack which has got resources in. We've also got things like this, this is one of the posters for one of the 6 campaigns that's been done up. And this is the one around alcohol. So Ian has kind of been leading on the content for these with some of his colleagues. And I'm sure there's people in the room who've been involved in some of those groups. What we've done is we're holding specialist workshops with professionals who have got knowledge and expertise of each of those 6 campaigns. A small amount of the information that's gathered in those workshops go on the posters, because we've worked with young people. The young advisors are working on these as well, and we know young people need short, digestible bits of information. What we're trying to then do is make sure young people are accessing the website where there's going to be a whole range of wider information, links to other websites, links to other services. So there's also on your table, just while I'm going through the what's on your table, one of these, which is a resource request form. Obviously, for each theme, there's going to be A2 and A4 posters. And what we would obviously love is for all your services to put in these posters up. Now, rather than us just giving loads of posters out and services getting too many or not enough, you're able to request which posters you would like and how many you would like. So there's some of those in the middle of your tables, and throughout today, or you can take them with you and send them back to us. You're able to order some of these resources and we will get them out once they've all been printed. So these posters will be going up and around Knowsley. They'll be going into, you know, leisure centres, health centres, hopefully in all your services, just to allow young people just to see very simply what are some of the facts around some of these things. There's going to be a series of posters that tackle myths around the different issues, and another series of posters that also gives young people 5 quick tips of how they can help themselves. Really simple stuff, and they'll obviously be available in the packs once they're ordered. So that's the poster side of the campaign. I've mentioned briefly the kind of awareness raising sessions we're going to do, but also we've got the website. Now, we know that website isn't for everyone, not all young people have got access to a website, but we do know, and young people do frequently tell us, that actually they're not going to, some young people aren't going to stop in front of a poster and look at it because they're afraid of what the stigma might be around it, they're afraid of other people seeing them. But if they can catch a website address really quickly and check it at home, check it on the phone where people can't see them, you know, that's what it is. We're working with a company who are building a website alongside our young advisors and young people, and it's going to be one of these fancy new websites that's going to look fantastic, whether you're looking at it on your mobile phone, whether it's a tablet, whether it's on a projection screen. You know, that website's going to have all the information of all those teams, and I'm hoping it's going to have all the information about all your services, because that's how we feel, as Matt said, about doing things differently. This is how we want to do things differently. We want to have one point of contact. I'm not saying services have probably got their own websites, their own bits of information, but we want one portal to pull it all together. A lot of our time this year is going to be not only delivering with young people, but working closely alongside, you know, yourselves and everyone else who couldn't be here today, to make sure we have as much information on that website as possible, but in a way that's accessible to young people. So it's about being smart how we do that, and that's why we're using young people right from the beginning. To date, we've had 67 young people involved in some of the design of the website and the poster, and we really want to expand that. This is the very early stages, but we're hoping after today, you know, you'll all be in touch with young people you're working with, or you might know of or have access to, who might want to get involved in this. The website is live in the fact that you can go on there and there's a little bit of information. All the extra content will be coming in the next couple of weeks. The reason we haven't launched it live for today is because obviously young people have had a massive input, but going back to the co-production element that Matt mentioned earlier, we want to make sure that it works for services as well and organisations. So after the break, we will be doing some work around showing you some of the screenshots of what the website looks like, and on your tables, the young advisors getting some feedback and getting some ideas from yourselves in terms of other things you might like added to the website, which we can then get built in before it goes live. So it really is not just fit for young people, but obviously services and organisations get something out of it as well. The website allows us to be responsive as well. There'll be lots of information there on the 6 themes, but obviously because it's instant, we can upload information to it very quickly and we can remove information very quickly. It allows us to be responsive to new and emerging issues like I still can't pronounce it. Yeah, say what, sorry? NPS, okay. Or legal highs, but it's not, you can't call it legal highs, but that's how I refer to it. Or also things like CSE, which we know is massive. Rather than doing an individual campaign on it, because we already know there's lots of work underway, we are just going to make sure that all that material is also on the website. So there's that opportunity for us to really tackle issues as they come in, as they maybe become less prevalent. It allows us to be flexible. As I say, we've got a whole team who will be able to go out to services and train them up. You won't be trained up to use the whole website, you will be trained up to use just that little bit of the website that you need to upload the content and upload the information. So just to give you a little example, there'll be a section on the website about alcohol. So if you're a service that provides support to young people about alcohol, you will just be able to go onto that little bit and put your information in. So it means that you don't have to worry about, you know, breaking anything or putting information where it shouldn't go. But Peter and the young advisors, myself, over the next couple of months, we'll be offering that support, and that support will be ongoing as well for the duration of the campaign. Because I'm sure we all know of or have seen or have been part of, you know, projects where a website's set up and 6 months later no one's putting anything on it, it's out of date, etc, etc. We're really trying to, again, get you all here to get that buy-in so services can do it themselves. We're there to support, but it's about saying if we all collectively, as Matt said, if we all collectively take a little slice of responsibility for this, then I'm sure it'll all work fantastically.